Right now we get to our conversation of the day where we're speaking about the interconnection between climate change and health. And joining me is Judy Omumbo, who is a head of programs at Science for Africa Foundation. Thank you so much for joining us.
Thank you for your invitation.
All right, now let's get right into the conversation and look at climate change. Of course, last week we had a whole week of Africa Climate Week and also the summit that ended on Wednesday. And now we remain with 2 days of commemorating the whole Africa Climate Week. But when we look at also the health sector and climate change, how are they interconnecting?
So, I'd like to say, first of all, last week was really exciting. I think it was wonderful to see that Africa taking leadership and being very clear about policies that benefit African people. And at the center of all those policies is development for the people of this continent. Now, the connection between the environment and climate and health is really through the environment itself and the pathogens or the things that cause diseases, the bacteria, the viruses, the fungus. They're in the soil, they're in the air, they're in the water. And it's because of that and the impact of the climate on those environments that we have a relationship between the health, the diseases that we experience as people and climate.
All right, now let's also look at the health risks posed by climate change, especially in Africa and how they impact the continent's population. First of all, even before we get to Africa, let us look at Kenya. What are some of the health risks that are posed by climate change?
So really it's about what diseases are influenced by climate.
Yes.
And we talk a lot of infectious diseases. I think as Kenyans we're very well aware that malaria tends to have a seasonal pattern. And malaria tends to behave according to how the mosquitoes that transmit malaria behave. So during a rainy season, for example, and after that rainy season, you have more mosquitoes, then a higher risk of infection. And similarly, other diseases. If you think about meningitis, it's known that the cycles of meningitis epidemics tend to follow dust. You know, we're very dusty seasons, particularly within the meningitis belt, which is across northern Africa. And other diseases similarly happen that way.
All right, and also now, when you look at such diseases, and also you've spoken about dust really contributing to this, what strategies and initiatives can be implemented to build sort of a healthcare system resilience within the Africa region?
That's an important question, Kelvin. I think we do expect that the expansion of the areas, geographical areas where some of these diseases occur will change. Areas that were not able to support the things that cause the disease in the past may in the future be able to do that. But I think it's good to think of us as a continent that is really evolving even in innovations and thought process and being able to put systems together. So we're not going to be sitting ducks. We are planning something.
Okay.
So we know that there's something coming ahead. It's possible that the expansion of these diseases may occur. And it's important for us to be prepared for that. You find in places where diseases are eradicated, it's not that it's not an environment that is unsuitable, it's that they have systems in place, surveillance, monitoring, strong health systems to respond. We saw during the COVID pandemic that we do need strong systems to support emerging illnesses as they come out. So it's really more about how we're going to tackle those things with our governance, our management, or logistics, and those kinds of things for the diseases that we know things about.
All right, and also with what you're speaking about, when you look at policy, how does it play a role in addressing the climate health nexus in Africa, and what specific policy measures do you think or believe are necessary to also mitigate these challenges that we go through?
So as you mentioned at the start, I work at the Science for Africa Foundation, and we support African scientists across the continent to address sustainable development. So policy is really at the center of the work that we support. And we believe that scientists and researchers in Africa need to be producing products. So because we're responding to sustainable development, policies at regional and national level are really what initiate the programs that we design. So following last week's announcements by the President of Kenya, for example, we see that we are focusing as a country on things like carbon sinks. We're looking at renewable energy system. We're looking at the opportunities in economic opportunities in our extractive industries. So as scientists, then we sit down and think, how can we help as a research community to provide evidence and support our scientists to address those decisions that have been made by leaders.
Now that you've mentioned about the declarations announced by President William Ruto, when you look at them and you look at some of the declarations that he made as a scientist, what do you think the declarations addressed the problems that we as a continent are facing?
So the heads of state do not just make declarations, you know, they gather information and they talk to those who have been working within their countries for a very long time before they actually come to a podium and say, this is the direction that we're going. So this is all backed by evidence. This is all backed by evidence, and it's really, really good to see that it's prioritizing us as a continent. This is what we see as most important. Other continents may see different things. But for us as a continent, I think the declarations that the President has made really fit the direction in which we need to be looking at for sustainable development.
All right. All right. Now, you mentioned about research. Of course, you come from Science for Africa Foundation. Now, share with us some insights, especially when it comes to research and development funding and what is needed to tackle climate-related health issues in Africa, and also how it can be mobilized effectively so that we are not just speaking about it, but at least on ground, something is happening.
Thank you for that opportunity to talk about that. Well, we see that the profile of diseases, you know, the sort of diseases that people have these days have changed. We see fewer infectious diseases. We see decreases in the diseases that have been eradicated that maybe 30 years ago were a real challenge. And now we have emerging illnesses. You know, a lot of concern about infections that we don't know anything about, new viruses. The crossover of as we go into environments where animals used to live and human beings are invading those populations. There's a crossover of infections from other species into the human population. And we must keep our eye on these. So when we're talking about policies to develop resilience and adaptation for that, we need to have things like good vaccine development, you know, research and development in vaccine, so that our researchers can react promptly when a new infection emerges. We need to look at things like resistance to antibiotics. So there are many diseases that we have antibiotics that work with, but resistance is really spreading. And with new diseases that are bacteria-based, we need to be able to develop antibiotics very quickly to make sure that our populations are kept protected.
Right, and also this question is with regards to your field. When it comes to science and where we are going and the years that are coming, if we have a disease like COVID come again, are we, as a continent, first of all, ready for this, or will we experience something that we experienced during COVID? Are there new measures that have been put in place, at least to take care of such a situation if it comes?
The exciting thing about a human being is that we do learn. We do learn. And it's important as scientists and researchers also to take the opportunities for learning from natural experiments. Something happens that changes the system. And that's a natural experiment because it gives you the opportunity to say, this works, this doesn't work. And a lot of innovation, in fact, even around vaccine development and genomics works, genetics works across the, you know, looking at the different types of variants of COVID, came out of Africa. So if something like that were to happen again, there's learning. And I think between now and then, opportunities to input systems that work. I think surveillance is really important, and making the systems work. That is a mark of developing resilience in the face of climate change.
Right. And also, Judy, if I may ask, any projects that you would like to highlight that show tangible benefits of even addressing climate change for public health in the African context, when you look at it? Just give us even projects that you would see or that you know are working right now.
So we do have many projects that we support, and I can confidently talk about those ones. We do have a project that has been invested a lot with partnerships across the continent on developing centers of excellence in different areas of science. So there are centers of excellence, for example, in genetics and genomics. And we're building these centers so that we understand the genetic factors that make us vulnerable to different diseases. Also, we understand how populations react to different infections and so on and so forth. And we see really for emerging illnesses, the understanding of genetics and genomics is really important. For one. And then there are also centers of excellence that are looking at drug development, the issue that I mentioned earlier of antimicrobial resistance and so on.
All right, lastly, even as we come to a conclusion of this conversation, why is it crucial for Africa to focus on the intersection between climate change and health? Why is it really a topic that we need to look at when it comes to how we are taking care of the environment and also the impact on our health at the end of the day?
So the climate crisis is actually a global emergency. And in our epoch, it's really an emergency that has been caused by our interaction with the environment. Really how humans have changed the environment, the whole cutting down of trees, clearing areas and destroying biodiversity. So in order to prevent that, to roll it back, we need to now learn to live within our environment in a sustainable way. So anything that we do in the environment that involves extraction is not sustainable. If you take it out and keep taking out, eventually it will get finished. And that's what we have been doing as a population. So many of the policies that are being put in place now, following even last week, to look at how we can restore that environment. How can we make sure that the forests are conserved and there's reforestation? And how can we have a true look at biodiversity to make sure that we are maintaining a diverse environment?
All right. Thank you so much, Judy, for that. We've come to the end of this conversation. We're going to go for a short break. We've been speaking with Judy Omumbo, who is the head of programs at Science for Africa Foundation, just about the interconnection between climate change and health. And now we're going to go for a short break. When we come back, we are going to be speaking about how the digital technology is helping transforming businesses in Kenya and even around the globe. And we'll be speaking to Evelyn Karimi, so don't go too far.